Now, I would like to move on to our next session, which is a research research session. So I would like to invite Dr. Graham Fieggen from South Africa and Dr. Nathan Manfroy from Germany to please turn on their mics and moderate the new session for us. Thank you.
Right. Hi, everybody. Shall I kick off?
Yes, sure.
So thank you, Salman. Thank you, everybody. It's been a fabulous program so far. That last session was really extraordinary. So thank you. It's a real treat to be part of this. And hello, looking through the names of 200 people online, lots of friends, lots of familiar names there. So hello to all of you from Cape Town. So we're going to start off the session with a talk on stereotactic DBS for dystonia. So Dr. Mota is going to be giving that talk. I just want to check, Dr. Nathan Manfroy, is Dr. Manfroy in the
Yes,
room?
I'm present.
Okay.
I was having issues with my video.
Great. Okay. Sorry, Nathan. Sorry to kick off in your place, but yeah.
Perfect. Thank you.
Get the session underway. So over to you, Dr. Mota.
Can you hear me?
Yeah, we can hear you loud and clear.
Okay, can you see the presentation?
We can see your presentation, yes. Thank you.
Perfect. So, hello, I'm Dr. Emilio Mota Gonzalez. I want to speak about a very beautiful and interesting mission that was carried on in Dominican Republic. It is called Stereotactic Deep Brain Stimulation for Fieggen Dystonia, joint venture between Germany and the Dominican Republic. So, the mission started in November 12 to November 15, 2023, from a travel from Hamburg, Germany, from the neurosurgical team from Uniclinicum to Santo Domingo, Sedimat, Dominican Republic. In this travel, Professor Ertel and his team with Matthias Holzer and Bianca, they came to meet the local expert team which are in charge of all the patients of Fieggen in Dominican Republic. This is a very rare disease. Why is Dominican Republic very important for this disease? Even though this disease has a very low prevalence in the world, in Dominican Republic, the prevalence of the mutation of the gene is very high. This means that we have a very high number of patients with this disease that don't have any solution for this problem. So that's why Professor Ertel team came to Dominican Republic to look patients with made the criteria to make the operation of deep brain stimulation as a solution for their dystonia problems. So in this mission, only the patients which made the criteria were selected. And then in a next mission, the surgery was carried out. So the next mission was in March from 2 to 9, 2025. The team traveled again to Dominican Republic to Sedimat to perform the surgery. In this time, the surgery was performed with the local team, was a multi-center collaboration with the neurosurgeons from Sedimat too. So before I speak about what happened in the surgery, I want to explain a little bit about what is Fieggen, because it is a very rare disease. Fieggen is short for pantethonate kinase associated neurodegeneration. It is a neurodegenerative disorder associated with iron accumulation in the basal nuclei, and it is characterized by progressive extrapyramidal dysfunction and dementia. And this also causes very hard, extreme dystonias. The problem is that in patients, especially in Dominican Republic, they have a variant of this disease that has oromandibular involvement. So they have very difficult time to speak, to eat, and that makes their life very hard. Classically, this disease presents between 7 and 15 years, but also can appear later in their life. And it is, in most cases, it is because a mutation of the PANK2 gene, which causes a problem in the metabolism of coenzyme A. So this makes this accumulation problem of iron in the nuclear ganglia. So we can see in this image in the right, that this accumulation of iron is primarily presented in the globi pallidi, substantia nigra, red nuclei. So you can see here that in the Basal ganglia, we can see this in this MRT from brain in T2 sequence. We see that there is a hypointensity with a point in the center of hyperintensity. This is a characteristic sign from this patient because of the accumulation of iron. And this made what is called in neuroradiology the eye of the tiger, because the shape that it makes is related. It looks like eye of the tiger, like we can see in the picture in the left. So now we will speak about the patient, the case report. The patient is a 27-year-old female diagnosed with Fieggen from several years before. She is in a very advanced stage of this disease. This disease has made her life very, very difficult. She cannot walk without help, without support. She cannot use freely her extremities. She cannot eat properly. She cannot speak properly, especially because the oromandibular involvement. And then she has had in the past several falls because of incoordination from this dystonia. Now we will see a video where she is making a neurological examination. So we can see it is very hard for her to coordinate her extremities, and we can see the deformation of them. Especially we can see also the oromandibular involvement, that she cannot close her mouth and she cannot have this control of this area. That's what is special about this variant of Fieggen patients. So we made the tomography before the surgery under sedation, so we could send the image to Germany to make the coordinates to make the implantation of the electrodes. So after this image was sent, we get the coordinates from the German team, and then they sell all the coordinates so we can make the implantation in the right and left nuclear ganglia of the electrodes. We can see here in the radiography, we can see the both electrodes already implanted. Because of time constraint, I cannot show more of the surgery because the time is not enough, so I'm sorry, but we will continue with this part. The surgery was without any complication. It was a very beautiful surgery. It was very nice. We have here in the left and the right, we can see the wounds from the surgery of the electrodes. Also, we can see here in the right, we can see a picture of where is the implantation of the battery from the stimulation. In this patient, it has to be in the abdominal subcutaneous area because she was very thin, so it couldn't be in the neck area, close to the neck area. And then what this surgery means from the future of Fieggen patients, especially in Dominican Republic. Right now, this patient is being taken care of from the neurosurgical team in Dominican Republic, also from the neurological team. They are making the programmation of the brain stimulation. The effect will take time to appear in the patient to see if she will improve or not, especially in the oromandibular involvements. So if this patient have success, very good success, the idea is that this surgery will be an alternative for these patients so they can have an improvement in quality of life. And also for the local expertise in Dominican Republic to profit to learn these techniques, and also in the future to make a international collaboration of this disease, and so we can have a hope. That's the objective of this procedure. So thank you for your attention and have a nice day.
Great. Thank you very much, Emilio. That was really a magnificent presentation. I just want to check whether my co-moderator has managed to get his microphone working.
The microphone is working, but the video not yet. I'm still working on it. But thank you, Dr. Mota, for this very interesting presentation.
Thank you.
Nathan, just a question. Is this German Wi-Fi or American Wi-Fi?
It's American Wi-Fi, that's why.
Okay. Carry
So
on.
Nathan, you're going to introduce the next speaker?